G'day ladies and gentlemen, this is Fron Landman from Key Wealth, and here's a quick discussion on the benefit summaries for the Bestmed Beat option for 2024. So first and foremost, a lot of people are on Beat 4, and this option does not give you cover for joint replacements. It will be covered in the event of a PMB or like a trauma accident if it meets the clinical definitions of a PMB. So for many people on this option, I would actually highly suggest downgrading to PACE 1, and you will save yourself a pretty penny without losing too many of your benefits. So if you're on Beat 4, please reach out to us to check whether it's a viable solution. It's just some chronic conditions that's not covered on PACE 1, so reach out so that we can assist you to save some money, and then let's rather add a nice gap cover if you do not have one. All right, so firstly, let's start off with the premiums. 6,832 Rand for the principal member, and then there are the rates for the adult dependents and the children. And then, so a nice thing that was added on this is the 150 Rand that you can get for take-home medicine that you get at a retail pharmacy. In the past, they only paid it for 7 days if you get it from the hospital's dispensary. So that's not the pharmacy at the hospital, that's the hospital's actual pharmacy or dispensary. Now you can get it at a Clicks or a discount. And just to give you an example, in the PACE 1 option, this is 200 Rand. So it's not much, but it is actually a little bit more. They do cover some biological medicine on this option. And let's go on to the next slide. So maxillofacial surgery, this is covered. Dental oral surgery, that's covered up to these limits. They've got a nice benefit for prosthetics. From the top of my head, PACE 1 is 109,000 Rand, so it's not a great reduction in benefits if you consider downgrading. And then here are the individual limits for all of the internal prosthetics. So they've added dual chamber pacemakers, so that's very nice. And then Bestmed now also pays for drug-eluting stents, which they did not pay for in the past, so that's great. Like I mentioned, the exclusions are major joint replacements, so shoulders, hips, knees, things like that. There's a limit on here for external prosthetics. These things can be extremely expensive, ranging in the hundreds of thousands of rands. So it's nice that the benefit is there, but if it's something that concerns you or that you require, just check upfront how much you need. Then Bestmed does not pay for the removal or surgery of the non-affected cancerous breast. So it's very important here to add gap cover. Gap cover has initial cancer diagnosis funds that pay out, which can maybe use for that procedure. And then also if it's on a double mastectomy and there's only cancer in the one breast, they also don't pay for the reconstruction of the healthy breast, where the gap cover has, some of them have benefits where they actually pay for those prosthetic devices after a double mastectomy, so that's very, very good. The specialized diagnostic imaging benefit, this is for MRI, CT scans and things like that. So very important here to know how they work. There's 40,000 Rand available in and out of hospital from next year. So out of hospital, this benefit has been enhanced. In hospital, it's been a reduction. They will continue to pay for PMBs, so that's great, but very important to get a gap cover here. And then the payment, co-payment here is 2,000 Rand per scan. So once again, this benefit is exactly the same as with PACE 1. So if you do a downgrade, there's not really a reduction in benefits for you. Then oncology, it's still one of Bestmed, still one of the better medical schemes in my opinion with regards to oncology. It's an unlimited benefit. You get a treatment plan from a specialist or from an oncologist. If it's covered under that treatment plan, then you're good to go. If it's not, you can upgrade within 30 days to the benefits that you require, or the plan that you require to get the best cover. So then on here, there's also 2,746 Rand co-payment if you do not make use of a DSP for a day procedure. So this is also something you can claim from gap cover. And then medical, international medical travel, as it was in the past. Bestmed has now included several co-payments on this option, which was not there in the past. These co-payments aren't more or less than any other medical schemes will have. They're in line, they're not that expensive, and the procedures aren't very uncommon on medical schemes that have co-payments. So this is also something where you can have a gap cover and make sure that those co-payments don't come from your own pocket. Right, the out-of-hospital benefits are quite nice. So this is where PACE 1 will be a little bit better. but it's still, for the amount of money that you save on the Beat 4 option, it's a good thing to consider that. But yeah, you'll have 15,000 Rand for an individual and 31,000 Rand of scheme benefits for a family. Remember how it works. It first comes out of your savings, all of your claims, and secondly, it comes out of your scheme benefit. So just so that you know how it works. So there's an amount that's available for GPs, there's an amount available for dentistry. So depending on a single or family, it's 7,000 for GPs and specialists, 13,000 Rand for dentists. There's a nice benefit for medical appliances, which is wheelchairs, CPAP machines, blood pressure machines, things like that. There's a hearing aid benefit of 12,770 Rand every 24 months, so that's great. And then supplementary services, which is a broad spectrum thing. It's anything from a occupational therapist to a homeopath, a psychologist, a psychiatrist, a physiotherapist. There's quite a lot of stuff that's covered from there. On the Beat 4 option, you've got good cover for your wound care, so that's very nice, and it's a pretty decent optical benefit that you have. Again, very similar to PACE 1, so just something to take note of. You must use a PPN provider. If you don't use a PPN provider, these limits will apply, but most optometrists are part of the PPN network, so that shouldn't be a problem for you. Right, so basic and radiology and pathology, so that's your blood tests and your black and white x-rays, covered up to 8,000 Rand. So just take note of that. We've already covered the CT scans out of hospital, so that's very cool. And then when it comes to the chronic medicine, it's covered. The CDL and PMB chronic medicine is covered in full, unless it's not formulary medicine, then there's a 20% co-payment. So that's not a high co-payment at all in the industry. There's 9 additional conditions, where PACE 1 has 7. I'll show you what they are now. A very nice benefit here, 18,000 Rand for those 9 additional conditions if you have anything. So 7,000 Rand for acute medicine for a family, that, and 1,116 Rand for over-the-counter medicine. So the additional conditions on this that PACE 1 does not cover is condition 8 and 9, gastroesophageal reflux disease, and obsessive compulsive disorder. So this is covered on the Beat 4 option. So if you have one of those conditions, I would not suggest downgrading, but if you are claiming for one of these, then you might save some money if you downgrade to PACE 1. Right, so flu vaccines covered for everybody on this option, pneumonia vaccines for kids and high-risk adults, travel vaccines are paid, pediatric immunizations. This option is generally structured for a more senior crowd, so I doubt that there's babies on here, but if they are, your pediatric immunizations are covered. So female contraceptives covered. They also pay for the UID once every 5 years, preventative dentistry, which I'll cover now, your mammograms, HPV vaccines, and PSA screenings for the corresponding ages, but it's covered also. Very important, they cover the test and not necessarily the consultation, so there might be claims from your day-to-day benefits. Preventative dentistry, very, very nice. You get 1 or 2 depending on your age. Consultations, they do a little bit of photos, scaling, polishing, fluoride treatment, visual sealing, which is very nice for kids under the age of 21 to prevent tooth decay, so that's also great. It's got a very good maternity program on here, so they pay for 9 antenatal consultations, 1 postnatal, 2 2D scans, and your supplements that you can claim here, 139 Rand per month. So very, very nice. And ladies and gentlemen, that's it from the Bestmed range, Bestmed Beat 4 range. If you're on this option and you're considering a downgrade, talk to us. If you're happy with what you're paying and the benefits you're getting, then you must have a prosperous training.